Deconstructed, Mental Health and Wellness with Dr. Kaz and George.
The statements of Dr. Kaz and George are not a substitute for medical care, and our opinions are our own. If you are experiencing a mental health emergency, please seek assistance from a professional in your area.
You can contact us via Twitter at MindDeconstruct. I'm your host, George. With me is Dr. Kaz. Dr. Kaz Nelson is an American Board of Psychiatry and Neurology certified psychiatrist, licensed to practice medicine in the state of Minnesota, and an assistant professor in the Department of Psychiatry at the University of Minnesota Medical School. On today's episode, the aftermath of mass trauma. Welcome to the show again. I just want to give a quick plug out there to everyone listening on iTunes and Stitcher and what else are we on?
Google Play.
Google Play Music. Please rate our show if you get a chance. A good rating would be great, but however you feel about the show, please give us some input and we will do better if we're not doing well. And thank you if you think we are doing well. We are going to be talking about the aftermath of mass trauma today. On October 1st, 2017, a gunman in Las Vegas killed at least 59 people and over 500 people were hurt in the incident. Dr. Kaz, that's pretty significant.
Yeah, it's a lot of people. And obviously the whole globe was aware of this event, and whether people were impacted through physical injury to their body or death, certainly the psychological and emotional trauma spans much farther than those figures even reflect.
I can only imagine what the people of Las Vegas are going through after something like that occurs. The people, not only the people that were there, but also people that were 1 mile away, 2 miles away. If you think about 9/11 and New York City as a whole and how that affected just large portions of the population in New York City and then in the U.S. and then also in the world, it just has this radiating effect, doesn't it?
Yes, there's only a few degrees of separation between all of us, and so the ripple effects of something like this really just can't be quantified.
So what are the common mental health effects following tragedies like these, like what recently happened in Las Vegas?
According to the Uniformed Services University of the Health Sciences in Bethesda, Maryland, in conjunction with the USU Center for the Study of Traumatic Stress, under the direction of Dr. Robert Ursano, who is the chair of the American Psychiatric Association Disaster Psychiatry Committee, the most common experience for those impacted will be that of grief. There's a tremendous amount of grief related to the loss of sense of safety, and anytime there's increased perception of threat or injury, it fundamentally impacts the nature of what it is to be a human being and really challenges our desire, which wants to believe in a just world. And so community leaders or healthcare providers or those who are in a position to support people through a trauma like this can work to reduce distress for affected communities through targeting that extreme grief and its impact.
Dr. Kaz, are you seeing any, in your practice, are you seeing any of these impacts?
What I've experienced in providing care for people with psychiatric needs is that people feel increasing sense of distress and nervousness. Particularly, the perpetrator in this instance appeared to be kind of just a normal guy, somebody in the neighborhood, maybe not particularly friendly, but nobody that was really on the radar of anybody for doing something of this nature. So if somebody like this can perpetrate this level of violence, what's stopping anyone else? And so I think it's hard to know who around you can trust, and that really impacts people's sense of well-being and their sense of safety, which increases stress and can increase psychiatric symptoms.
Recently, there was also a mass tragedy that occurred in Somalia. And here in Minnesota, we have a large Somali community, and I did listen to a portion of a story on NPR about how that's impacting the Somali community. It's just another example of how these mass tragedies, I don't know if they're more common than they have previously, but they really do seem to have an effect on people.
Yes, certainly there's been groups of people over our history who have been slaughtered or killed in mass tragedies. And so, we certainly don't want to discount things that have happened historically or even in the last couple centuries, episodes of genocide or mass slaughter. But in our modern era, the last few decades, it does appear that these types of events are increasing. There may be a contagion effect in the society or almost a desensitization to these kinds of attacks. And particularly for our Somali community to have this happen in Somalia and to be here, I can't imagine the sense of helplessness that our community members are experiencing, feeling that they're in a whole other continent while their loved ones are falling victim to this form of violence is completely unimaginable.
So what about the first responders then? How are they going to get through this?
Well, this kind of mass injury or death on this scale is really not something that most responders or healthcare providers are really even prepared for, even if they've done 100 preparedness drills. And in fact, mass casualty planning usually maxes out for the kind of casualty that you'd see like with a airplane crash of around 200 people. So in this case, more than twice the number have been impacted. So it's certainly natural for the first responder community or the local healthcare community to really have a lot of guilt or second guess what they should have had done differently. And so as we talk about this, we need to affirm our first responders and the local healthcare community to let them know that whatever they did at the scene or to manage this event was really heroic and the best of what they could do, and to really work to support people through managing any sense of guilt they might have of not having done more, because it's really just unfathomable how one could even effectively respond to attack of this nature. And we really need to keep in mind that care for the caregivers and sustaining their well-being is particularly significant with something like this. And so those of you who know a caregiver or a first responder, if you can maintain this as part of your conversation with them and your support of them, to acknowledge that their job is not easy and what they see is very difficult, validate those things. I think we all owe it to these heroes who have a very complicated internal and emotional response to witnessing this kind of trauma.
Isn't it also interesting how it isn't just the first responders, the people who signed up to be first responders? I mean, there were so many people there and so many people injured that random people, random cars passing by, like so many people turned into first responders.
That's right. Yep.
It's just fascinating that
applying tourniquets, driving to the hospital, loading up the pickup truck full of people. Yeah, so many people banded together to try to minimize the loss of life and injury to this event. It really, really reflects the best of what our country and our communities have to offer.
And with no training, those people are going to need some aftercare, I would assume.
Yeah, I would recommend that because, even witnessing a car accident on the side of the road is something that can be deeply unsettling or cause loss of sleep or cause you to have intrusive images of something traumatic like that. So being in a concert venue, being under attack yourself, supporting those around you who may be in high risk or injured or dead or dying, that's something that's going to stick with people for a long time. And we do have some approaches and best practices for supporting them to minimize the long-term impact of these kinds of events. But that requires insight into the nature of how this impacts you and a willingness to reach out and accept help.
Post-traumatic stress disorder, it's something that's commonly been associated recently with service members returning from Iraq and Afghanistan, and those service members may have experiences that are in some ways similar,
witnessing violence,
witnessing death.
fearing death themselves.
Exactly. Are there lessons to be learned from how service members are currently receiving treatment for PTSD?
Our veterans have been some of our best teachers in helping us understand the after effects of stress and trauma. And this population of patients in the healthcare setting have helped us really understand some of the best practices for treating post-traumatic stress disorder. And we still have a long ways to go in its treatment, but over the last couple decades, we're starting to get a better handle on how to assist people with some of the physiological and emotional impacts of this type of event.
When I returned from Iraq the first time, I don't think I was offered or received any sort of mental health screening or services. When I returned from Afghanistan, I had to do a little online questionnaire prior to being returned to, full duty. Are there effective screening tools out there for persons that may be suffering the effects of these trauma-related instances?
Every healthcare provider I know would love to have a crystal ball that we could look into and really truly predict who's at high risk for a serious or concerning outcome and who's a lower risk. We don't have that. We do have some general screening tools that could help us pick out people who may be at higher risk. Of course, that assumes that the individual is answering honestly and openly to the questions. It's something we can do. It's something that we feel we should do to make sure that the issue is on the forefront of people's minds, but they're not perfect. And we would love to know better how to catch people who are suffering to serious degrees with these kinds of impacts. There's a lot of people that feel shame or feel they shouldn't be feeling that way, and so they actually minimize their response on questionnaires because they feel that this is something that they want to handle alone. And we've just found that is ineffective in many cases, and sometimes it takes a team of people to actually help with the recovery process.
Yeah, on a voluntary questionnaire, if you aren't ready to seek help, you're going to provide answers that you think are going to indicate you don't need help, I would assume.
Yeah, that's simply human nature.
Okay, let's turn to some questions that we've seen out there regarding these mass trauma incidents. The media is ever present these days. I know I watch a lot of news. And with this latest Las Vegas incident, there's a lot of replaying of the video, of the audio of the gunfire. There's a lot of stories about bump stocks. What's the best way to handle that?
Well, one thing you can do is actually turn off the TV or turn off the news and limit your exposure to some of the media coverage, particularly if there are children present or children in the room who are more vulnerable to those kinds of prompts. So the more we can reach out to schools and medical clinics and shopping malls and restaurants and provide support, but also get the message out that limiting this kind of exposure to constant prompts and images and sounds of this type of violence, that might help with some of the resiliency of recovering from things of this nature. And it's generally a good idea to avoid this kind of exposure for children.
So right now, the federal government places restrictions on persons with previous mental health commitments, ability to purchase firearms.
Is that true?
Yes.
How do you know that?
Because when you fill out a form to purchase a firearm, it says, have you previously had a mental health commitment? And if you answer yes, you don't get a gun. I can double check that, but that's my understanding.
Okay.
But, that doesn't tell the whole picture of someone's mental health.
And that also relies on a self-report in that instance, right? That's not checked against a database.
It is checked against the database, but reporting to that database is notoriously spotty per different states.
Mm-hmm.
So what's the relationship between mental illness and violence?
Well, unfortunately, societally, we do have this somewhat unfair and unjustified relationship between mental illness and violence. It's a true statistic that those with mental illness are actually more likely to be the victim of violent crime than to be a perpetrator of violent crime. We don't know in the Las Vegas instance whether the shooter had a history of mental illness, but it's certainly been part of the conversation where people were saying, well, he didn't really have a stated manifesto or rationale for inflicting this violence, so he must have been mentally ill. And I think that's an extremely concerning connection to make, and it's unwarranted. Sometimes people make choices like this that are destructive or dangerous in violence, and we think, gosh, in order to make those kinds of decisions, somebody must have had to have been mentally ill. But it's unfair to say that without evidence, particularly because of the stigma that this propagates against people who do have mental illness and are more likely to be a victim than a perpetrator.
To answer your question before, 18 U.S.C. 922D states that it's unlawful for any person to sell or otherwise dispose of any firearm or ammunition to any person knowing or having reasonable cause to believe that such person, quote, has been adjudicated as a mental defective or has been committed to any mental institution. So first question with that is mental defective a psychiatric term?
It's not one that I would use in my practice, no.
Okay.
Civil commitment is an issue that I come up against where people are a danger to themselves or others, and a judge can adjudicate somebody as needing to be under a civil commitment in order to preserve the safety of themselves and others.
And again, I do know that the reporting to that database is spotty. So it's
yeah, I'm interested to know what are the mechanics of that, because certainly me as a physician, I'm not required to enter anybody's name in a database or anything like that. So whether that would be on the county's end or how that works, I'm unsure about that.
Maybe the court system or something like that.
A civil commitment database is not something that I hear, regular reference to. So that's why your question surprised me.
No, I don't think it's anything that, say, a doctor would have access to or anything like that.
I do want to have another podcast, though, about post-traumatic incidents and get into a little more detail about the nature of post-traumatic stress disorder, how it impacts the brain and body, and there's a lot more to talk about there. So today we visited the idea of the impact of mass trauma because it was timely with events happening in the news. But in the future, we're going to take a little bit of a deeper dive on the issue of PTSD. So keep us on your download list. Yeah,
and again, check us out on Facebook, the Mind Deconstructed page, like us, Twitter, send us a direct message, iTunes,
Google Play,
all those great ones.
Stitcher.
Thank you for joining us today. This podcast was produced by Kaz and George. Music by Paul.
He's the best.
Contact us and send us your questions on Twitter at Mind Deconstruct.